welcome and thank you for joining me this evening. My name is Wendy Gerhardt and I am the Executive Director of Migraine Canada, and I'm really privileged to be representing the community on a daily basis. So for the next 25 or so minutes, I'm going to go through several slides, and my slide deck did grow, so I might go through and I might skip a few questions, but we're going to be discussing about the who, what, why, when, how of advocacy, and then talk a little bit about what reimbursement looks like in Canada for migraine products or treatments. And then we can move into a Q&A. We are recording this webinar, so it will be available on our website later this week or early next week. And again, just enter your questions into the Q&A, and I'll try to monitor those as we go if I can. And if not, we'll just get to them at the end of the webinar. And I'm trying to advance my slides and not working. Okay, so really quickly, I just want to go through who Migraine Canada is. So we're a national organization with the sole purpose to support individuals living with migraine and other headache-related conditions. We are a federally registered charity as of February of 2022. So we're super excited to have this status awarded to us. Our board is comprised of volunteers. We have a good mixture of healthcare professionals and then others with competencies in like legal, accounting, others with board experience, communications, and that kind of thing. So we have a really fruitful and really engaged board. So I'm happy to be working with all of these individuals. And our frontline team is small but mighty, and it includes myself as executive director. And we also have a part-time social media coordinator and an events and programs administrator. All right, so our mission is to improve the lives of Canadians with migraine and other headache disorders through our five pillars: awareness, support, education, advocacy, and research. And if you want more information on exactly what our strategic purposes are, these can be found on our website. I have to take a minute to recognize and thank from the bottom of my heart our sponsors. Here is a list of all of the industry partners that have supported our webinars series. So we're very grateful and thankful to have them on board and supporting us. All right, so why we're here tonight is the patient voice. So how to access medications in Canada. There are three ways to access medications. So it's through public access, private insurance, and out-of-pocket. When we refer to public access, this means where the provincial government provides product through their formularies / drug benefit programs. Public plans are paid for and administered by the provincial and territorial governments. And most plans cover medications and vaccines for eligible groups. So this includes seniors, recipients of social assistance, and individuals with conditions that are associated with high drug costs. And then private insurance coverage is provided by employers. So this is an employer who purchases a benefit package to offer to their employees. And that is part of your compensation package, if you will. And then the third option is out of pocket, which is really the least ideal option, is when you have to like physically pay for your medications. And I know this isn't a great option for many people. So I just wanted to talk a little bit about migraine reimbursement in Canada. So approximately the majority, approximately 75% of Canadians with migraine have private coverage. So that's through an employer. And 25% rely on the public drug programs. The majority of private drug plans have special authorization forms, so it's not like a full benefit where it's automatic. It requires paperwork, and it often requires criteria where you have to like try and fail on 2 preventatives before you're eligible to get coverage through the provincial drug plan. And unfortunately, 1.8% of Canadians don't have access to the public program or the private insurers. And they kind of like fall into a bit of a crack, as I say, unfortunately. But we're working on that. Okay, so advocacy, what is it? Why do we do it? How do we do it? And to whom do we do it? Okay, so advocacy is basically it's making social change, policy change. It's changing the status quo. We're trying to create an environment in which we have better options, we have better choices, that kind of thing. It raises awareness to government, to employers, to healthcare professionals and educators. It's working in partnerships and building coalitions to strengthen our messaging. And it's appealing for public support. So who does it? Who does advocacy? Really, in a nutshell, everybody can advocate. People advocate and they don't even know they're doing it. For example, if you're asking to be referred to a specialist by your GP or your nurse practitioner, you're advocating for yourself. If you're asking to try a different treatment, you're advocating for yourself. Think of it in really simple terms. Even children advocate when they're pleading their case to stay up at night or to go to a party. So basically, everybody is advocates. It's just a matter of recognizing that and really putting all of the factors in play and getting your message through. Whoop, I think I went one too far. Let me see. So there are 2 types of advocacy. There are individual and systemic. So individual advocacy focuses on the person. Systemic advocacy focuses on the system, the society, and the domain of government relations. If you were to ask me where my efforts are generally placed, my response would be I am a bit of both. So I'm responsible as a representative of Migraine Canada to advocate for advocacy strategy and priorities, drug relations and policy. So I do advocate at the CADTH level and the PCPA level, PMPRB, National Pharmacare. I also advocate at the public and private insurance levels. I'm also responsible for, in systemic advocacy, for all government relations. So I'm building relationships with elected officials across Canada, and I'm keeping pressure on government to raise awareness and increase support of the programs and policies that affect migraine patients in Canada. And lastly, I support individual advocacy. So focusing on the person and the people supporting the community by giving you guidance, developing resources and that kind of thing that you can use for your individual advocacy efforts. All right. Okay, so who do we advocate to? So members of government. So we advocate to our MP. It depends on where you are located in Canada. It's different in each province. So MPs, MLAs, MPPs, MNAs, ministers, so not just the Minister of Health, opposition critics, standing committees, non-elected officials, so political staff of those that are elected, so assistants, aides, advisors, schedulers, and the civil servants. So this is policy analysts, advisors, drug plan managers, and others. This is kind of a new bucket that I added into this presentation, but who else do we advocate to? We advocate to healthcare professionals. We advocate to employers, educators, and to our family and friends. All right, so where do we advocate? So we can advocate at the federal level. Most of our advocacy efforts are at provincial. This is where I spend a lot of my time, but part of my time is spent at federal on larger policy issues that impact the country. So for example, PMPRB, which is pricing, is at federal, and also National Pharmacare is a good example of a federal policy where I would be focusing some efforts. Most of my time is really spent at the provincial level, which is really trying to advocate to raise awareness about migraine and to put us on the map and to make the people who are making decisions be aware of the unmet need for new medications. There's also regional and municipal governments that can be advocated to, but those are more for things like, if you're advocating for, there to be a new soccer pitch or something like that. So, but most of our focuses, you and me, are at the provincial level. And the issues. So our issues are access to medications, as I think probably everybody on the webinar tonight would agree with. We advocate for access to care. We advocate for the underdiagnosed and undertreated to have access and be diagnosed. We access to disability programs, we advocate to access to disability programs, and we advocate to eliminating stigma, which is a huge part of the world that we live in. So non-government related advocacy. So who do we advocate to? So we advocate to healthcare professionals, employers, private insurers, educators, and again, our family and friends. And what are our issues to these stakeholders? So again, access to treatment options, access to care, access to headache specialists, getting referred, second opinions, workplace accommodation, and again, stigma. So how do we advocate? So we advocate in several ways. We can advocate by email/mail, phone calls, in-person meetings, lobby days and receptions, and we can also advocate by petitions. So I just wanted to throw in this slide because I wanted to outline sort of what our challenges are. So timing, the Canadian drug review process from Health Canada to CADTH review to PCPA negotiations takes years. It's simply not acceptable, but it is a reality. Pricing. As we have new innovative medications coming to market, these are more expensive than older generation medications who are now generic, and they cost pennies. They cost pennies. The system, I don't think yet recognizes the value of medications to treat migraine. And that's part of the conversations that I'm having with government, is what these new innovative medications are actually bringing to migraine patients. And I guess, again, the big S word is stigma. Like, migraine is not understood and it is not recognized. And we have a mountain to climb to change thinking, change thought, because people already have programmed in their mind that migraine is just a headache. And so we need to educate and change that thinking so that people are aware. I wanted to just add in this slide about patients' rights and responsibilities. So as a Canadian, you have rights. You have right to a treatment. You have right not to be refused urgent care. You have right to a diagnosis, a right to coverage, and even a right to appeal if you think your rights have not been respected. You also have, as a Canadian, as a patient, you also have responsibilities such as providing accurate information to your healthcare team, asking questions to make sure that you understand the information that is being shared with you is understood and that you're following your treatment plan. It's important to you as an individual to take an active role in your healthcare. And I can't stress that enough. You need to make sure that you're getting the answers that you need about your disease and your condition, and you need to educate yourself and learn how to talk to your doctor and other members of your healthcare team. Many people feel anxious when they are first diagnosed, and they can be nervous when they talk to their family physician or their specialist. But you need to understand your rights. You need to ask your questions. You need to feel like you are fully engaged and that you're in the driver's seat. Okay, so effectively, we're going to jump right into government, and then we're going to go into healthcare professionals, and then we're going to go into a bit of information about employers. So the steps outlined in the next couple slides are relevant to writing a letter requesting a phone call or an in-person meeting. If you're writing to the Minister of Health, you'll likely only be voicing your concern or expecting a response. Strongly encourage you to write to your elected local representative, either your federal member of parliament, so your MP or your MPP or your MNA, again, depending on where you live. What's really important is that you develop 3 key messages that clearly explain your issue and your concerns in simple language. Be brief, be clear, have your facts outlined, and be consistent in your messaging. Also recommend that you have somebody read your email before sending it, so that it makes sense to the person who is on the receiving end of it. And again, if you're writing to your local representative, I definitely encourage you to request a meeting. It's their obligation to meet with the people of their jurisdictions. The Minister of Health, yeah, you're likely not going to get a meeting. You might, but I would always encourage you to write to your local representative and copy the Minister of Health, because the more the Minister of Health is hearing about our issues across the country, the more traction and attention that we're going to gain. Okay, so how to develop, and I apologize, I keep glancing off to my screen, how to develop your messages. So there are 3 key components in developing your message. So stating the problem, offer a solution, and what you are asking. So what is the problem? So what is the issue to be addressed? What's wrong or needs to be changed, and why? And if you have a hook that can draw people into your story, that's always really a great thing. Offer a solution. So how to solve the problem. Adding X product into the formulary of X provincial formulary. Adding it to the benefit plan of the company that I work for. And if there's opportunity to draw out what makes the story newsworthy and keeps people engaged, that's always really positive as well. And we also want to have a call to action. So the behavior that we want the person we're advocating to do. So what do we want the person to do? Do we want the person to talk to the Minister of Health? Do we want the person to talk to the drug plan, or all of the above? So we need to have a plan. So determine your one ask. So what are you going to ask for? Choose one thing, not a list. You can always go back for more meetings or for more requests. So for example, your one ask might be to cover CGRPs on the Alberta drug plan, or Botox. Alberta is not a good example because Botox is actually covered on their formulary, but you know what I'm saying is, so you have one ask. What is it that you're looking for? I would like to have Aimovig, Ajovy, Vyepti covered on X province's drug plan. Only choosing one requires you to make a choice. So you need to make a choice as to what is most important to you. And again, I fall back to what I just said. You can go back in 3 weeks with another ask, but you can only make one ask at a time. And you need to build your ask into your call of action key message to help ensure that it's delivered. You can also explore opportunities that might make your ask timely. So like, election times are good to have these conversations, but that's not saying that any other time of the year is not a good time to advocate. Again, your elected officials have a responsibility to meet and listen to your issues and your concerns. So a sample outline of a letter or an email. So the first paragraph would be sort of who you are and why you're writing and what your ask is. The second paragraph should include a short paragraph about your personal story and your link to the issue. How does migraine impact your life? What are your issues with accessing treatment? The third paragraph should be a combination of 3 messages and some key facts about the issue. And I emphasize that you need in all of your advocacy efforts that you are citing factual information. And then the fourth paragraph is you restate what your ask is in bold. And the fifth paragraph is closing, and you'll be in touch shortly to arrange a time to meet or to follow up. Yeah. So if you secure an in-person meeting with your local representative, do your research, know your issue inside and out, and have some facts to support what your issue is. And if you can, try to learn a little bit about your government representative. We always advise to prepare a meeting script to keep you on track. Have a leave behind. So you can create one yourself, or Migraine Canada will be adding a fact sheet that you can download from our website to our advocacy page. Simply, you can download it, save it, and send it, or bring it with you. Always recommend that you take notes and you write a debrief, more so to yourself, just because you're tracking the conversations that you're having and what was said and the outcomes, so that you have that in your back pocket if you need to do additional further advocacy. And always, always, always send a thank you letter and follow up on any information that you promised to send or action items that your elected official committed to. Okay. So tips for a productive meeting, now that you've written your letter, you have a meeting date, and now you're going to your meeting live or by phone. So try to develop a connection in the introduction. So maybe something you have in common that may just come up organically. Ask if they know about migraine. Assume the person that you're speaking with does not know much and that you are really the expert, and have a short summary prepared in explaining what your condition is, what your symptoms are, how your life is impacted, maybe statistics on your province, that kind of thing. And then dive into your issues. So really make it a 30-second pitch of your issue, kind of like what everybody refers to as the elevator pitch. And then you always need to present a solution, have one ask. It could be as simple as, please include this medication on your provincial drug plan so patients have access to it. The leave behind, again, it should not be longer than 1 page. It should be background information on the issue. And it should really include extra information that you're not really going to get to in your meeting. But that is factual. And again, Migraine Canada is developing a one-pager that we'll post on our website for you to download and share. And if you can, includes province-specific information if available. I have a lot of provincial stats, so you can feel free to reach out to me, and I have a lot of that information. Okay, so the one thing Migraine Canada does have, recently launched in the fall of 2021, is an advocacy platform. So it is a seamless automated platform. We have 5 templates of different letters for different topics. So people who are on CGRPs, people wanting to go onto CGRP but can't because of access issues, people who have been on and have had good experience. We have a Botox letter, we have shortage of physicians and headache specialist letter, and we have triptans. And we'll be adding more template letters related to how to manage communications with insurers and also with employers. Our advocacy platform has a toolbox of advocacy tips that goes into a lot more detail than what I'm sharing tonight. But basically the process has been made simple for you. As I love the word seamless. So basically you pick the appropriate letter for your situation, you enter in the information requested, which is your postal code. What will pop up is your local elected official. You select that person, you select the Minister of Health, you personalize your letter as you feel fit, and then you hit send, and everything is kind of done for you. So really welcome feedback for those of you who have done this or who will do it and then have comments back to us. Again, you can access our advocacy platform through our website, which is www.migrainecanada.org. And I will just say, I'm always encouraging people to send in letters because the government is hearing from me and I'm representing the community. But the more people that write into their elected officials and their ministers of health, it will really make an impact. We need to get migraine sort of like on the map, if you will. And you're the best person to share your personal story. I talk on behalf of the community and I share the concerns and everything, but your voice is powerful. Okay. Petitions. The Chronic Migraine Support Group Canada, they have 7 active petitions. If you, I wouldn't say if you don't want to write a letter to your local representative, but in addition to writing letters to your local officials, I would also encourage you to take a look at these petitions and sign on to these as well. Together we're stronger, and I can't emphasize enough to take a few minutes to try to eliminate the stigma, make access to medications a reality, and that kind of thing. So effectively engaging healthcare professionals. So how to advocate with our healthcare professionals? What do we say? So always encourage you to make a list. Include all of your symptoms from the last time that you had an appointment, or if it's a new appointment. If it's a new appointment, more so important to take the time to prepare. Example, migraine frequency and intensity. What is the pain level? Sleeplessness, nausea. What is your mental health like? All very, very important things to capture and to have sort of a record of. And we have lots of great trackers that can help you with this information. How long have you had these symptoms? Are things getting better? Are things getting worse? What what kinds of medications are helping you? What have you tried? What gets worse if you don't take it? What gets worse if you do take it? Make sure that you have a list of all the medications that you're currently taking, including prescription drugs, over-the-counter medications, herbal remedies, supplements. If you're taking medications for a disease completely not associated with migraine, it's important for your healthcare professional to see everything that you're taking. So what to ask? So it's also really important to put some time into planning your appointment and to write down questions you have. I'm not going to go through all these questions. We'll put something on our website that kind of gives you a guide, but really don't be afraid to take notes. We often forget what we were told during our appointments with physicians. You may also wish to bring a family member or a friend along to medical appointments to make sure that you don't miss important information, particularly if you're in the middle of an attack. Our brain is always foggy as it is, and so having somebody else there to help us is important. And you could, as a courtesy, just tell your doctor why you're taking notes. And again, we'll put sort of this information on our website as a resource that you can download and kind of go through the questions and select as you feel appropriate. How to ask for a referral or a second opinion. So again, I cannot emphasize enough, do not be afraid to ask for a referral or seek a second opinion. It is your right as a patient. And it allows you to have the opportunity to learn more about your disease, to gain a different perspective on the disease, your personal situation, and on treatment options. And it also will provide reassurance and a peace of mind that you're making the right treatment decisions. Many patients worry about telling the doctor they plan to seek a second opinion, but you shouldn't. Most doctors are pretty comfortable with the request, particularly if the doctor feels he or she doesn't have any more ideas, options to offer. Telling a patient that there is nothing more that he or she can do is absolutely not acceptable. And as patients, you should stand up for yourself and just say, no, there has to be something else we can do. So I've thrown in a few slides about from our quality of life survey, which we'll be starting to promote in the fall. We ran a quality of life survey in October, November of 2021. We had a great response. There was 1,165 people who responded. So I've just pulled a few slides just related to this that might be of interest to you. So how were you referred to specialized care? So of the respondents, over 35% asked to be referred. So that's pretty significant. Great news, primary care providers, 57% took the initiative to refer. So that is really, for me, encouraging in that the primary care provider kind of knows when he or she has hit the wall and needs to refer on to specialty. And 8% of respondents took the initiative to self-refer. So this number is a little bit, I don't know, crazy, because in most provinces, you can't self-refer. It has to be a referral from a healthcare professional. So for those respondents who were able to, that's amazing, and good for them that they actually went on to pursue that. How supportive was the GP or the nurse practitioner when treating the migraine? Only 42% of respondents think their healthcare professional is supportive, and 7% not supportive. So those numbers are, a little bit noteworthy and concerning. How knowledgeable is your GP/nurse practitioner when treating your migraine? So only 23% of respondents think that their healthcare professional is very knowledgeable, and 62% are only somewhat knowledgeable. So again, lots of work to be done around educating our primary care providers. So effectively managing employers. So if your claim is rejected by an insurance company, so, and this, unfortunately does happen. So check to make sure that you have not had a claim for that you have not submitted a claim for something that you're not entitled to. So make sure that you understand what is covered by your private insurance. If you think you're entitled, like if you've gone through and you're like, yeah, no, like I'm meeting all the criteria, I don't understand, the product is on the formulary. Don't let the first or second rejection stop you. There's generally an appeals process that you can go through, and just make sure that your physician is on board and supplying the necessary supporting document to your advantage. Sometimes healthcare professionals make errors, and that is the cause of a claim being denied. So just make sure that the healthcare professional has filled out the forms appropriately and that kind of thing. If that fails, contact the insurance company's ombudsman or a compliance officer. They all have them. And I know that this is escalating quite a bit, and many of us don't have the time or the patience to do this, but if you really feel like you have met criteria, then I encourage you to pursue. And I'm not going to go into detail about the rest of it. You can just take it up with the ombudsman. Okay, so I have private insurance, but my drug is not covered. If your employer has excluded the drug from the benefit plan, at this point, you may decide, if you've not already, to disclose your condition to your HR manager or your supervisor. I generally encourage you to go right to HR. Usually, I think your supervisor may know that you have a condition, or maybe not, but it is the HR manager that has is more closely aligned with what is covered and what is not on the benefit formulary. So describe your condition, provide information, and ask your employer to either update the drug plan to include your drug as part of the plan or to make an exception. You may have to provide information on what migraine is, the symptoms, what you go through on a day-to-day basis. If it's not covered, ask your health benefits manager why they decided not to cover the drug. I think in most cases for migraine, they're probably not aware that there are new medications to treat migraine and how prevalent it is in society. Ask if there's an opportunity to apply for an interim coverage. It is in the best fiscal interest of an organization to keep their staff healthy and on the job. And I have a few statistics from our quality of life survey that I'm going to jump into. And of course, document all communications and exchanges that you have. And we'll be including some more information and resources on our advocacy website related directly to employers. So I just wanted to highlight a little bit about impact on migraine at work. So only 7% of participants who were working full-time reported no impact of migraine on the work. So for example, there was no loss in productivity, there was no missed days due to migraine, but more than 1/3 of participants, 36%, reported that they work full-time and missed several days of work due to their migraines. And 8% of participants reported working only part-time because of their migraines, and they still missed more than 1 day of work per month. So the impact is fairly significant if you think about how massive our workforce is. Impact of migraine on career. So again, more than 3/4 of participants indicated that migraine impacted their career in some way. 25% expressed that migraine limited their ability to remain in a work position. And many were affected early in their career, impacting their education journey, 20%, and career choices, 22%. And disclosure of migraine at work. So 63% of participants indicated that they had disclosed their migraine diagnosis to their employer. Of the participants who disclosed, 62% indicated that they did so because their migraine had a negative impact on their work. And alternatively, of the participants who did not disclose, 43% that they refrained from sharing their diagnosis with their employer despite its impact on work because they were concerned about the consequences. So lots of work to be done on educating employers. When we asked, why did you disclose your illness? 62% of people disclosed their condition because it negatively impacted their work. Why did you not disclose your illness? 43% of people are impacted at work did not disclose their condition because of concern for consequences. So maybe not being promoted, being demoted, being perhaps fired. Okay, so asking for accommodation in the workplace or education institution. So really important if you're going to, disclose your condition, educate your supervisor on migraine. Explain how you are impacted in the workplace and life in general, and how accommodations could have a positive impact on presenteeism and absenteeism. And you may even have to explain what those two terms are. But be reasonable in what you're asking for. And again, document all your communications and your exchanges with your supervisor or human relations representative. So reasonable accommodations. So I'm not going to go into detail, and this is going to be recorded and you can look at it, but here's a light list of what reasonable accommodations look like. And this really can carry over in a lot of cases to the classroom. So probably should update this slide to be migraine at work and in the classroom setting. And I just threw this in here because I thought it was a great slide and stats is only 21% of the respondents in our survey could confidently say that their coworkers knew what migraine is. The majority, 44%, felt that their coworkers had little understanding of what migraine is. And 22% indicated that the coworkers did not understand what migraine is at all. So again, lots of work to be done in the workplace. So I wanted to talk a little bit about the treatment landscape in Canada. So at the current moment, we're working on a report card that will give us a snapshot of what is covered across Canada in every province. So triptans, we see some coverage across Canada. Combined analgesics, it's a bit spotty. Botox is only covered in Alberta. Alberta is actually full benefits. So sort of like, no criteria to be met, no forms to be filled out. It's quite a simple process. Ontario, Quebec, you have to fill out some forms, but people are getting access to it in those two provinces. The rest of the country, no coverage. CGRP, so Ajovy is covered in all the provinces across Canada except PEI. So we're anxiously waiting for PEI to make an announcement. And this is great news because it's the first CGRP to go through the Pan-Canadian Pharmaceutical Alliance negotiations, which is called PCPA, and I apologize for acronyms on these slides. Emgality is currently being negotiated at PCPA. So we're just anxiously waiting the outcome of that for a positive letter of intent, which will allow it to move on to provincial listings. Aimovig, the PCPA negotiations closed without a letter of intent. So I am actively advocating to the jurisdictions about the need for all CGRPs to be included on the formularies to create choice for patients and clinicians. And then Vyepti is being reviewed by CADTH. I'm actually preparing the submission that has a deadline of Monday to put in our patient input on that. Same with INES. INES is, which is the Quebec kind of version of CADA. The deadline is also next week. So I'm working with Migraine Quebec on that submission. GPANTS, Atogepant, the NOC is anticipated at any time. Our CADA submission has been submitted, as has the INES submission. And devices, GammaCore and Cephaly, they are not covered on any provincial or private insurance program. So that's kind of the landscape of what reimbursement looks like in Canada, and why this takes up so much of my time, because it's so important and we need to get these products through the processes and actually into the medicine cabinets of everybody in Canada. So what is Migraine Canada doing and what is our messaging? So I meet with the ministers of health, I meet with the drug plan managers, I have outreach to meet with other ministries, so health critics, finance, women's health, children, starting to develop our strategy for meeting with employers. We just had a really great webinar with Capital One, employees of Capital One, and the feedback was like really, really well received. And insurers, we're part of the fall strategy is to start meeting with insurers and making sure that, you know, if medications are being included on the formula, on their formulary, that it actually translates into getting onto employers' benefit packages. So public reimbursement is complicated, and private reimbursement through insurers is even more complicated, but we'll get there, and it's definitely on our radar and we're working for it. And our messaging, I'm not going to go into detail, like the unmet need for medications, the unmet need for access to specialists. We need improved care, and we need to eliminate stigma, which will play a large part in kind of pulling this all together. So resources that Migraine Canada is currently working on. We're actively working on a report card, which is going to give a snapshot of what access to treatment and services care looks like across Canada by province. And we'll really be able to kind of call out the jurisdictions where things look grim, which is most provinces. But nonetheless, I think our decision makers, they need to see it sort of in black and white. As I mentioned, we did our quality of life survey last fall. We're just currently working with the analysis of the results. We're working with two researchers actually from the United States who are renowned researchers in migraine. So they're actively helping us with the analysis and the cleanup of that data. And then from that, we will be developing resources, so a report and infographics that we'll be able to post on the website and have available for you to share, and also for me to share out to the jurisdictions. We do have a fact sheet that we have developed, and so it's just a matter of getting that on the website. That will get up there in the very near future. We're also working with pediatric neurologists to develop resources for parents to use for their children in the school system. And then lastly, we'll be adding information, robust information on the provincial and territory healthcare systems in each province, because as you probably know, each province is unique. They have different criteria, they have different terms. Some use exceptional access programs, some use special authority. So we'll be highlighting sort of all of that, so you can just quickly go look up your province. You don't need to know about Ontario, and then know exactly what it is, how coverage is outrolled, and basically it'll be your place to go for navigating that. And what else can you do? So join our community, become a part of our community at on our website and join the community. Share your voice. I really strongly encourage you to take the time to write to your elected official, asking for a meeting or just simply stating your issues. In large part, access to medication is what I hear on a daily basis. But I can only do so much. I really need to sort of hit our government officials with like a tidal wave of your shared personal experiences and that kind of thing, because that really backs up what I'm saying to them. So I really encourage you to visit our advocacy platform. It's very simple. Other than adding in your personal experience, it's really very seamless. And again, I encourage you to sign a petition. As I mentioned before, there's 7 petitions that are active. Get behind the chronic migraine group and sign your name to a petition. That literally takes like 10 seconds of your time. And with that, I think we're done. As we move to Q&A, yeah, just let's go into Q&A.